to get to as many as we can. And let's start with Megan. Megan at Politico.
Hi there. Sorry, I was having trouble unmuting. I guess I'm curious to see, you all have been part of this national wastewater surveillance system. And I think there's been, a lot of hope that it could be sort of this widespread monitoring tool state by state. Are you all feeling like you are receiving the support you need from the federal government as far as their surveillance program is concerned? And how effective do you think this could be as sort of a widespread monitoring tool, given that, obviously you all are participating with many sites in the program, but we still haven't seen other states ramp up?
Yeah, I think you kind of point out that this is a very new surveillance system, particularly to be deployed at this scale. There's wastewater-based epidemiology has been around for a number of years, and I think that we saw very early on, particularly some of the projects being done over in Europe, some of the benefits that can be derived from doing this type of thing at scale. So, as you pointed out, Wisconsin, we were some of the first ones kind of out of the gate at this, in close collaboration with our laboratory partners at the State Lab of Hygiene, and really grew to a large scale pretty quickly. When you grow a system that fast, it comes with a certain number of challenges when you go to scale, particularly when you're doing something that is this new. We're figuring out the science as we go. I would say to your point about CDC, they've been excellent partners throughout this. There's a lot of shared learning that goes back and forth between the states that are participating in this program and the subject matter experts at CDC. They've assisted us with, kind of data interpretation and communications. And at the same time, we've, shared, some of the challenges and successes we've had as well. So I think it's been a very successful kind of community of learning and community of practice that they've established. And I think kind of the next level and the next challenge we have going forward is, how do we expand this out to make this, kind of more robust and national surveillance system.
All right, let's go now to David Wahlberg. David.
Sorry about that. Yeah, I noticed, at least with Madison, for example, there's kind of a discrepancy between what the state site says and what the CDC site says. The most recent information says moderate decrease on the DHS site, but the CDC has a red dot indicating a large increase. Can you explain those differences?
Yeah, we've really tried to align ourselves with how CDC is assessing trends. And so the calculations are done very similarly between us and CDC to try to minimize those discrepancies. We have to look into specifically kind of what may be happening with the Madison site, but there are oftentimes some reporting lags between when we receive the data. Right, it has to go from the laboratories to us, to our dashboard, and then upload it to the national data set. So with any surveillance system, there are oftentimes data lags that may result in some of these kind of temporary discrepancies depending on which one you're looking at. But by and large, the methods that we're using for calculating trends are similar and comparable between us and our national partners.
Thank you for that. Let's go now to Kent. Kent at WISN.
Hi, thanks for doing this. If I'm reading it correctly, it seems there was a large spike within the past week here in the Milwaukee area, particularly at Jones Island, and I'm wondering whether have you seen this sort of dramatic increase in the past, and does that indicate to you that there is an increase in cases, positive cases coming?
Yeah, thanks for asking this question. I think I might back up and provide a little bit of background to provide some more context for what you're asking. The way that we're looking at trends is that they are relative, so they are compared to recent levels that we've measured. And as cases have come down across Wisconsin, the level of virus that we're able to recover from wastewater has come down as well. And in fact, levels are pretty low across the board. So when we see large increases, that is in comparison to or relative to other recent measurements. So when you see, large increases in some systems, that means it's higher than it was in the last few measurements. This creates some challenges. In some particularly smaller systems, we may have more variability when we get at those low levels, and hence some observed increases may be kind of some natural variation when we're measuring virus concentrations that are that low. However, as you point out, some of the larger systems, particularly Jones Island, we are seeing steady upticks in the amount of virus recovered from wastewater, which is more suggestive or indicative of increasing community transmission. And that really kind of gets the whole concept and the whole theory and the purpose behind this type of surveillance. Wastewater has been shown to, kind of precede increases in cases as picked up through our more traditional surveillance systems. And so it can kind of give us a kind of an early peek or an early look at what we may be seeing later on with cases that are diagnosed and reported to public health. And so this is really more of a, wastewater is a useful supplement to our existing surveillance systems. Everybody I talk to about this, it's not a replacement. No surveillance system in and of itself is perfect. And what we want to do is kind of pull all the data we have together to paint a coherent picture of what we believe is going on.
Thank you for that. Let's go now to Sean Kirkby. Sean?
Hi, thanks for holding this. Just was wondering, when it comes to tracking variants, I presume you can't do this, but can you do genomic sequencing of the virus that's coming from these kind of wastewater facilities and get an idea of how many, are BA2 or Omicron? Thank you.
Yeah, it's a great question. There are a couple ways to look at variants in wastewater. There's some other states that have done this. One is to look for specific mutations that are indicative of a variant being present. Our laboratory partners at the University of Wisconsin-Milwaukee and the State Lab of Hygiene have been working on those methods for a while. And so we do have some ways of finding markers in wastewater that would indicate that a particular variant is present. Your other question about sequencing, right, is looking at a larger section of genetic code and getting a really good answer in terms of what variant is actually being recovered from wastewater. That is an emerging area. I'd say that's a high priority area for every site in every state that is doing this. And there's some excellent work being done over the State Laboratory of Hygiene using sequencing specifically for wastewater. It's challenging compared to doing it, say, from a sample taken from a person, right, from when they have testing for COVID-19. But those methods and approaches have evolved very quickly. And so I think if you have more questions around sequencing, we encourage you to reach out to the State Lab of Hygiene, who can kind of provide you some more details and context for that specifically. But that's really ultimately where we want to go. We want to be able to do not only looking at the levels and kind of looking at which direction they're going, but also to look at the specific type of variant that is being detected in wastewater. As you may have seen reported by CDC, sometimes you can pick up presence of a particular variant in wastewater before it's sequenced in a person. So through our more typical sequencing methods.
Thank you. Next question to Tiffany Olson, please. Tiffany.
This is Chuck Oedsma for Tiffany. How soon can the communities get this data? I'm sorry. How soon are the communities able to get this data, and how should they be using it?
Yeah, we provide the data on our public dashboard as soon as we receive it. There has to be some kind of quality checks done at the lab level, and then we do have some quality checks at DHS. But by and large, we try to get the data as soon as it's available up on our public-facing dashboard. That's been our goal from the very beginning when we launched it in late 2020. So we want to be as transparent as possible. To your question about kind of what should the public do with it, I would kind of put this in terms of kind of two broad categories. One is, what's its utility to public health specifically? One of the kind of main benefits is, as I was saying before, it's a supplement to existing surveillance systems. So it can be used to confirm trends that we're seeing in clinical testing data. It can also provide a preview of what we may be seeing in terms of community transmission going forward. And I see that being a particular value as we get farther into this pandemic and COVID-19 becomes endemic, as people may be less likely to seek out testing, or they may be doing more home testing. We don't get those results to public health. As for how this could be can be useful to the public, I think any messaging that we can provide that gives a sense of what may be coming can be helpful. Because there are a lot of things that people can do to protect themselves, whether that's getting vaccinated, getting boosted if they haven't been boosted. And then of course, now we have very effective medications for the treatment of COVID-19. And if we have an indication that COVID-19 is increasing in transmission in a community, you're somebody who is at high risk, it's very important to get tested so you can get access to that treatment, which really helps prevent severe disease.
Thank you for that. Let's go now to Drew Sutherland in Wausau. Drew.
Hi, thank you for doing this. Just to piggyback on that last question, because if I weren't a reporter, I probably wouldn't be going to the dashboard. Are there any sorts of recommendations or cooperation with the CDC or anybody like that to get the word out there beyond that, especially considering that there's an uptick in cases in Europe right now?
To get the word about what we're seeing in terms of wastewater. Yeah, CDC has messaged on that. I saw a recent interview with one of the leads for the CDC team, pointing out that they're seeing a rise in a lot of the states that are doing this across the board. Again, indicative that we could be heading in the direction that Europe is. But yes, I mean, we want to be transparent and open with these data, but we also want to make sure that the public kind of understands it, and we have kind of clear messaging in terms of what we can do at this point going forward. So getting back to the kind of earlier questions about variability when wastewater levels are low, I think over the next week or so, we're going to get a lot more data points, and we're going to firm up kind of what direction we think things are heading with a lot of these sites where we're testing.
Thank you. Now to Bridgit at Wisconsin Public Radio.
Hi, yeah, thank you. I'm curious about how frequently the wastewater is being tested at various sites around the state. Is there variation from site to site, and what does that mean for maybe people in places whose water isn't being tested as much?
Right. Yeah, that's one of the things that's an active topic of kind of investigation is what is the optimal timing or frequency at which you test wastewater. For our larger sites, we make a point of trying to test at least twice per week. That gives enough resolution, so to speak, to really try to identify trends early on. Other smaller sites are currently being tested about one time per week. I think going forward as we move into the rest of this year, really finding that optimal frequency, probably moving to twice a week is going to be a goal, because it does provide a little better information in terms of trends in particular communities.
All right, and Scott Bauer.
Hi, thanks. So I think what I'm hearing you say is that it's too early to really draw any conclusions from what you're seeing in the wastewater data. Is that correct? And if it's not correct, what should be the 3 sentences I tell the state of Wisconsin today about what's going on?
Yeah, I would say in several of the sites where we've seen increases, I would agree it's probably too early to tell. We need to gather some more data to kind of confirm those trends. However, in some of the sites, particularly in areas like Green Bay, Jones Island, and Milwaukee, those are sites where we're seeing some consistent increases that would be indicative of increasing community transmission of COVID-19.
All right, let's go to Monique in Green Bay. Monique.
Hi, thank you. So how do you test the accuracy of the findings? I mean, I know when UW Oshkosh was conducting this and doing the wastewater testing there, they would then test, that dorm, so to speak. So is this something that you guys are doing as well to test the findings or the accuracy of the findings?
Yeah, I mean, it kind of calls to question of, accuracy compared to what. So in terms of the how it's done in the lab, there's been an immense amount of work to ensure that the amount of virus recovered is accurately reflective of what's actually in the wastewater. So there's kind of that first step, which is making sure that all the lab methods work as we want them to. And large teams over the state lab and UW Milwaukee have done phenomenal work in that. What you're kind of asking, if I can interpret that as a larger question about, how well does it correlate or how accurate is it to cases in the community? And as I was saying earlier, we don't have a perfect way of knowing how many cases of COVID-19 are in a community at any one moment. And a lot of people may not get tested. We may not know about it or receive the data of public health, or people may not have symptoms. And so really what we try to do is go back and compare that to our existing surveillance data and saying where wastewater testing works well in terms of predicting and correlating with those diagnosed cases that are reported to public health, and where it works less well. And so, as we build out this system, we're learning as we go. And that's been kind of a consistent refrain from CDC as well. We're finding areas where it works better. We're finding areas where it doesn't work as well. And so what we want to do is, in doing those connections between wastewater and our diagnosed cases, find out what the best place is, what are the communities where this works the best, whether it's a community of a particular size, and what's the optimal frequency for doing that.
Thank you. Let's go to Eric Gunn. Eric?
Hi, can you hear me okay?
Yeah, you sound good.
Good, thanks. So reading the map that you have on the website, I do get confused about some of the recency of the data. It seems like a lot of the areas it's saying as of March 8th and yet it says the data was, the whole map was updated as of, I think, 3/17 yesterday. Can you help us understand the difference between that one piece of information and then the other piece of information about like how often the individual cities are updating their information?
Yeah, there are a couple of factors at play. One is how frequently each site is tested. So some are tested only once per week, others are tested twice per week. The other is that inevitable lag between when a sample is actually taken by a wastewater utility that has to be shipped to a lab. There's usually at least a couple of days of work there to do the analysis, ensure that the results are accurate. There's a lot of quality control that has to be done there. And then that gets sent to the Department of Health Services. So there is an inherent lag there between when a sample is drawn, that's the date that you're seeing on the dashboard, and when we can actually report out those results. We really want to get that window of time down as short as possible, but there will always be some level of lag there, but we're always looking for efficiencies, what we can do either in how we transfer data or efficiencies in the laboratory to shorten that time as much as possible.
Thank you. And now I apologize if I'm not saying this correctly. Rommel Brown, Rommel, is that right? Milwaukee Courier. And I think you have to *6 possibly to mute or unmute. All right, we'll try to go back. Let's move on to Sarah Volpenhein. Sarah?
Hi, thanks for taking my question. I'm wondering if you can talk a little bit about the limitations of the data in terms of telling where exactly COVID-19 is spreading in a district. And in the case of the Milwaukee Jones Island district, is there anything you can do with wastewater data to tell where in the district transmission is particularly high?
So you mean, no, so when you look at, go on and look at our website, what you'll see there are boundaries for a sewer shed. So that's basically all the areas that kind of a sewer feeds into to a treatment plant. Those boundaries are very different than boundaries we may be familiar with, like municipal boundaries, zip codes, or counties. And so what we have to do is we have to kind of, when we compare wastewater to our cases, we have to kind of figure out where those cases are. So what we're doing when we're taking in that sample, analyzing it, is we're basically conducting pool testing on a community. And that community is, encompasses all those areas that feed into a particular treatment plant. So within those areas that feed into a particular treatment plant, we can identify within those, generally speaking, where within that there may be increased transmission. It's an overall kind of picture over that entire, what we call a sewer shed. There are some, and we've done some kind of a limited analyses of looking at smaller levels. So within a sewer shed, you can kind of break it down into smaller levels. And then as another questioner asked about, there have been some work here, limited work here in Wisconsin, but more in other states about even doing it at smaller levels, like an individual facility. But for what you're seeing here in the data we present publicly, we really are using that to draw conclusions about within a particular sewer shed, what is COVID-19 transmission likely doing?
Thank you. Let's go to Brittany in Wausau. Brittany, WAOW.
Yes, thank you. So what advice would you have to viewers that maybe say, you know, by the time you find out that there's, you know, maybe COVID in your wastewater, they've already recovered, just the importance of the research that you guys are doing to help stop the spread?
Yeah, I think I'll go back to what we discussed earlier. So, you know, anytime we see transmission increasing in the community, you know, however we find out about it, whether it's through wastewater or our more traditional surveillance systems, I mean, I think that's an indication to people to really think about what they can do to protect themselves and their families, whether that's getting a booster vaccination, making sure that they've got access to testing and that they are testing if they get symptomatic, particularly if there's somebody who could be at higher risk for severe disease. You know, this is still causing significant morbidity and mortality across the United States, but we have ways of preventing that with both vaccinations and therapeutics. And so really what I would like the public to kind of think about when they look at any of our data is when it looks like things are increasing and there could be more transmission in their community, think about ways they can protect themselves.
Thank you. Denise Lockwoo. Denise.
Good morning. My question is around just what is the data telling you with regards to communities of color, especially with knowing that a lot of those communities are not as vaccinated as communities of of non-color. So I'm just curious about that.
Yeah, because we're looking at an entire, as I said before, a sewer shed, or basically an entire community served by a wastewater treatment plant, we're really not able to draw any conclusions or infer anything about particular groups, neighborhoods within that boundary. You know, that potentially is something we could answer with more detailed kind of testing of smaller areas within a particular sewer shed. But really what we're able to do is find an overall picture of what's going on within an area that's served by a single treatment plant.
Thank you. Let's go to Annie in Green Bay. Annie Kroll.
Yes, thanks so much, Elizabeth. I'm kind of curious in terms of what y'all are thinking when it comes to how accurate the wastewater numbers are, considering so many people are getting tested less and less frequently. Is this wastewater sort of data point going to be more helpful just because we don't have as many testing numbers as we used to?
Yeah, I think you hit on one of the key reasons that this is an approach for doing surveillance of disease that's of increasing interest across the country, which is it is independent of any testing that gets performed, whether that's at home or a community testing site or at a healthcare provider. And so it does provide, it's a supplement, it's an independent way of looking at transmission within communities. And so I think it's going to be potentially very useful, particularly as we get farther on into the year, particularly into the early fall, of giving another way of looking at disease transmission within the community, because it is not dependent on those other data sources. You know, that also presents challenges when you have potentially one data source indicating trends in a particular direction that may not be reflected elsewhere. But that's something that, you know, I think we're going to learn a lot more about in the months ahead to really unlock the full potential of this new surveillance method.
And now let's go to Andrea in Milwaukee.
Hi, thanks so much. I know we talked earlier about sequencing variants. Curious if there's any detection of the new BA2 variant that's being talked about?
No, sequencing efforts are pretty limited right now. A lot of that's still kind of in the initial phases of work at the different laboratories here at the State Lab of Hygiene. As I mentioned before, there are ways of looking at wastewater for very specific mutations that could be indicative the presence of a variant, say Omicron or the subvariant BA2. We're doing some of that preliminary work now. We don't have any information that we can share at this point in time.
All right, thank you. Next question to Alex Moe. Alex?
No questions, thank you.
All right, thank you. Bret in Milwaukee. Bret?
Hi, yeah, thank you. You said that there still needs to be more data to really interpret what we're seeing, but what would signal concern for you?
I think what would signal would be an indication that what we're seeing is a clear sign of increasing COVID-19 transmission is if the levels in wastewater, which they are in a couple systems, are getting consistently above a very low level where we expect to see a lot of variability. So when those levels get very low, you can see a lot of kind of bouncing around in the measurements. When they get higher, those kind of the accuracy of those measurements improves. We start to see very consistent increases over the next week or two. I think we're going to have be able to make a lot more kind of definitive statements about what we are observing right now.
Thank you. Let's go to John Neisser in Green Bay. John?
Yes, thanks for taking the question. How long would someone who has COVID have an identifiable amount of that in their waste? What kind of window of time are they going to show up in this data?
It can vary quite a bit from person to person. So it can be on the orders of days, and persons who may have, immunocompromising conditions, it could be even on the order of weeks. Normally, we're looking on the orders of, days to a week or a little bit more, not that long. So there is a little bit of a lag, say when cases begin to decline, you'll continue to see it in wastewater. However, as we've seen here and elsewhere, not only here in the United States, but in Europe, on the other side of that is it can also be a leading indicator in wastewater. So.
All right, thank you so much for that. And that did have to be, apologies, the last question. We have to get Dr. Myman to his next scheduled appointment. I know we didn't get to everyone. If you have additional questions that we didn't answer, email DHS Media. We will do our best to answer them for you. And we appreciate your time, Dr. Myman, and everyone else, we appreciate your time as well. And we will talk to you later.
Yeah, thanks everybody for their questions. Have a good weekend.